Hello, we're here at the American Academy of Ophthalmology, and we're introducing the Diaton Tonometer, tonometry through the eyelid. The Diaton allows you to measure intraocular pressure through the upper eyelid, not through the cornea. It's a handheld device, and we could demonstrate to you now how it's being used, how quick and easy the process really is. Please. Thank you for being me. So, the patient positioning, we'll start with that. You could use just a regular chair and ask the patient to sit down a little bit further on the chair. This way there's more angle on a patient's back, okay, in order to have less angle on the neck. What I would ask the patient to do is, so with the device, for just a moment, my apology, you do not need any tips or covers, but you use alcohol swab to wipe off the tip of the device. Just take off the tip, just a protective cover. Now, simply wipe off the tip of the device, okay, and it's ready to be used. As a matter of fact, that's the carry case for the Diaton. The device is pre-calibrated. There's no need to calibrate the device before each and every use. You do have a calibration tester just in case you want to test the calibration of the device, but it's not necessary on a daily basis and or between each use. So the device is ready to go as soon as you take it out of the box. So with the patient, thank you for participating. So I would ask the patient to, for one, tilt their head back as horizontal as possible and extend the thumb forward. The reason for the thumb, we're centering patient's eye, okay? Get the head as horizontal as possible. And you could zoom in on this eye for me. So the patient is looking straight at the finger, as you could see. Now, I get the tonometer into a ready position. This little floater goes inside. I turn it on. Use the edge of my palm for support on the patient's forehead. Ask the patient to make sure they looking at the thumb. Gently pull on the lid to make sure the edge of the lid is above the limbus. Position right behind the eyelashes. 1 and 2. You have -2, it's number of readings. Press the center button, you get average and the number. Okay, and we're at 16 here. On the other eye, so if you're right-handed, you will be on the left-hand side of the patient. Okay, to do the other eye, same positioning. Okay, I would normally just proceed to the eye that's opposite. I turn it off, turn it back on. Here I use the index finger. Here I would reach over and use the thumb to pull the eyelid. So I'm pulling the lid upwards, not to the side, but upwards without pressing on the eyeball. Very important because you don't want to create additional pressure. Yet again, use the edge of your palm for support. 1 and 2. Okay? Press the center button, we get an average of the readings. Okay? So, quick, painless, non-invasive, no risk of infection, okay, because the reading is done on the upper eyelid. There's no contact with the cornea, no mucous membrane, no cross-contamination and such. One of the key benefits of this technology is cornea is not a factor. So corneal thickness, crookedness, rigidity, even lenses, like a scleral lenses, would not affect our contact lenses. You do not need to take them out. You could measure with the lenses on the eye. Some of the studies that have been recently introduced was with artificial corneas, Boston keratoparestheses, and with, as I mentioned, also scleral lenses. Another application that's a newer application of this technology because there's no other device that measures through the eyelid. So everything else, as I mentioned earlier, is measuring directly through the cornea. So anytime there's a discrepancy in the cornea, okay, it will affect whatever reading that you may get. But since we're taking cornea as the factor out of the equation and we're measuring on the eyelid, okay, above the edge of the limbus, the corneal parameters would not affect the reading. And that's one of the key values and innovations in ophthalmology, and would like to be part of your practice and assist you to get accurate readings each and every time. Check us out online at tonometer.diaton.com and or simply diaton.com. Hello and goodbye from American Academy of Ophthalmology, and thank you, and looking forward to working with you and your teams to prevent blindness. Okay, take care.
$50. Probably. It probably cost $400 Million is making money in glaucoma. Today I saw one person who is